Good afternoon, everyone, and welcome to the Iowa Tobacco Prevention Alliance kind of lunch and learn to hear from some national and state speakers about addressing tobacco use and vaping. My name is Tracy Kennedy. I'll serve as your moderator today. I'm the Midwest State Strategist with Americans for Non-Smokers' Rights, based right here in Iowa, and we are a member of the Iowa Tobacco Prevention Coalition. ITEPA is comprised of public health organizations. We're all united in our efforts to reduce tobacco-related death and disease. We work to advocate for evidence-based, effective tobacco control policies that prevent Iowans from starting to use tobacco products and helping them to quit. So together, we are all committed to implementing, as I said, these evidence-based strategies, which you're going to hear more about today, to reduce use of all products, including e-cigarettes. So I have the pleasure of introducing two fabulous featured speakers you're going to hear from today. Each of them will present to us, followed by some question and answer. So if you have lingering questions as they're presenting, you may put those in the chat or save those for the end of the program. We'd love to hear from you. So today we're going to hear first from Thomas Carr. Thomas is the National Director for Policy at the American Lung Association, a role he's served in since October of 2010. In this role, he directs state and local tobacco control policy efforts and assists with federal tobacco control policy efforts for the American Lung Association. He's the primary author and editor of the Lung Association's annual State of Tobacco Control report. So I'm sure we're all going to hear how Iowa measures up. He also oversees the American Lung Association State Legislative Actions on Tobacco Issues project, an online database and website of state and tobacco control laws. Mr. Carr is one of the country's most knowledgeable experts on state tobacco control laws and policies. He has a bachelor's in political science from Gettysburg College. So after Thomas, we're going to hear from Tabitha Girdner, the Iowa Tobacco Program Manager for the Iowa Department of Health and Human Services. She plays a pivotal role in tackling all the tobacco-related challenges in our state. With a wealth of experience in the field, Tabitha served as the Quitline Program Manager for 4 years, contributing significantly to tobacco cessation efforts. Tabitha's expertise extends to researching emerging trends in tobacco products and conducting comprehensive surveys to better understand tobacco use among disparate populations. Her dedication and impact in this area were recognized when she presented at the National Conference on Tobacco Health, showcasing her work in a statewide health needs assessment. One of Tabitha's notable achievements is her role in spearheading Iowa's implementation of My Life, My Quit, a groundbreaking cessation program tailored specifically for youth aged 13 to 17. Her leadership in managing the rollout of this program in Iowa distinguishes her as one of the many individuals in the state dedicated to combating teen tobacco and vaping addiction, a major issue. Well, we're very much looking forward to hearing from Thomas. So Thomas, I'll turn it over to you.
Great. Thanks, Tracy. Greetings, everyone, from our nation's capital in Washington, D.C. As Tracy mentioned, I'm Thomas Carr, National Director of Policy with the American Lung Association. It's my pleasure to be here today to talk about national and state policies to prevent and reduce tobacco use. Next slide, please. Here's a look at the topics I'm hoping to address today. I'm going to go through a number of developments that have been occurring at the national level regarding policies to prevent and reduce tobacco use. Talk about the grades Iowa received in the Lung Association's State of Tobacco Control report this past January and how those compare to neighboring states. And talk briefly about a few activities the tobacco and e-cigarette industries have been engaged in to protect their profits at the expense of public health. Next slide, please. There are several significant policies to prevent and reduce tobacco use moving through the process at the national level that could have significant effects on adult and youth tobacco use rates, including in Iowa. I'm going to go into more detail about those on the next few slides. Next slide, please. First, I want to give a little background on the Family Smoking Prevention and Tobacco Control Act, or Tobacco Control Act for short. This was a bipartisan law passed by Congress and signed into law in 2009 that gave the U.S. Food and Drug Administration comprehensive authority over the manufacturing, marketing, and sale of tobacco products. Prior to the law, the tobacco industry was free to introduce, make claims about, and market their products without any oversight. So it could be thought of as like a game of whack-a-mole. FDA created a Center for Tobacco Products within its larger structure to implement this law. And many of the regulations and actions I'll talk about next are related to authorities granted or requirements under this act. Next slide, please. One provision in the 2009 Tobacco Control Act prohibited most flavors in cigarettes, with menthol being the only and glaring flavoring allowed in cigarettes since then, glaring exception. In April 2022, FDA's Center for Tobacco Products proposed two rules. One to prohibit menthol as a characterizing flavor in cigarettes, and another that stops the sale of all flavored cigars. The comment period for these rules closed in October 2022, and some important news to announce just yesterday, both rules were sent by FDA to the White House Office of Management and Budget for review. This is the last step in the process before these rules are finalized. Once finalized and implemented, the Lung Association believes this will be the single most significant action taken by FDA in its over 14-year history of regulating tobacco products. The rules are expected to both cause hundreds of thousands of people who use these products to quit and save hundreds of thousands of lives, both from people quitting and preventing kids from starting in the first place. We do expect tobacco companies to instantly file a lawsuit once the rules are finalized, which could delay implementation potentially. Next slide, please. So a little bit about menthol. Menthol is a chemical naturally found in peppermint and other mint plants, but it can also be made in a lab. And it is known to reduce the harshness of cigarette smoke and the irritation from nicotine. This makes it easier to start using menthol cigarettes and harder for current menthol users to quit. Menthol was first added to cigarettes in the 1920s and 1930s. It is how a significant number of kids start using cigarettes. Around 50% try their first cigarette being a menthol cigarette. Next slide, please. Through targeted marketing, including tailored advertising, giving out free samples, and funding community organizations, cigarette companies have intentionally targeted Black and other communities with menthol cigarettes for decades. This has resulted in disproportionate use in those communities compared to others, and has been particularly devastating in the Black community. One study found that menthol cigarettes were responsible for 1.5 million new people starting to smoke and 157,000 smoking-related premature deaths, more than would be expected among Black Americans from 1980 to 2018. Next slide, please. The 2009 Tobacco Control Act also amended a section of the Federal Cigarette Labeling and Advertising Act, directing FDA to issue regulations requiring color graphics depicting the negative health consequences of smoking to accompany new textual warning statements. After an earlier attempt was struck down by the courts, in March 2020, FDA finalized its cigarette warning rule, establishing 11 new cigarette health warnings to depict some of the lesser known but serious health risks of smoking. Unfortunately, these warning labels were also struck down by the U.S. District Court judge in December 2022. This decision has been appealed, and we are awaiting a decision from the U.S. Court of Appeals for the Fifth Circuit. So that's where things currently stand with this right now. Next slide, please. Given nicotine is what makes quitting cigarettes so challenging, the Biden administration has indicated in its federal regulatory agenda that it intends to propose a rule to reduce the level of nicotine in cigarettes and possibly other combusted tobacco products. The Lung Association believes that any proposed rule should apply to all tobacco products, including e-cigarettes, to maximize the benefits of the rule. While it is on the federal regulatory agenda, that does not mean that a proposed rule will be issued, and it is unclear at this time when this proposed rule might be issued, if at all. Next slide, please. On to a little bit about e-cigarettes and talking about some of the harms there. We have studied cigarettes and some other tobacco products for a long time and know the effects they pose to lung health and overall well-being pretty well. E-cigarettes, however, are a relatively new product. What we do know is that e-cigarettes produce an aerosol when inhaled, much like other tobacco products. It contains harmful and potentially harmful chemicals that can cause lung damage and disease, and the developing lungs of youth may be more at risk. Overall, the American Lung Association is very troubled by the evolving evidence about the impact of e-cigarettes on the lungs. Recent evidence has also indicated that the risk of heart disease may not be significantly less in e-cigarettes compared to cigarettes. Next slide, please. No e-cigarette has been found safe and effective by FDA to help people who smoke quit their nicotine addiction entirely. Unfortunately, what is more likely to happen is smokers will use both e-cigarettes and cigarettes, often referred to as dual use, or completely switching to e-cigarettes, which only changes how a person gets their nicotine. In the case of dual use as well, too, it opens people up to, it does not reduce their risk at all. It opens people up to additional risks from e-cigarettes that may not be present in cigarettes. An equivalent might be using smokeless tobacco instead of cigarettes. In addition, a disturbingly high number of young adults, 18 to 24-year-olds who use e-cigarettes, did not use cigarettes previously, 61% in 2021, according to CDC data. That's why the Lung Association recommends that both adults and teens end their dependence on nicotine once and for all. The Lung Association does have evidence-based programs, freedom from smoking and not on tobacco, that can help any adult or teen quit. I'll also note the vital importance of youth and adult data collection here to be able to understand trends over time in regards to e-cigarettes and other tobacco products. Next slide, please. In January 2020, the FDA announced that it planned to remove most flavored e-cigarette cartridge products from the market. So that would be like Juul products. However, this action applied to fruit and dessert flavors, but not menthol or tobacco flavored products. Also, it only applied to flavored cartridges, not open tank systems or many disposables. This has caused a shift among youth to flavored disposable e-cigarette products over a period of several years. First to Puff Bar, pictured here, and more recently to Elf Bar, also known as EB Design. There are also a number of other e-cigarette products that youth use as well too. Next slide, please. Due to a successful lawsuit by the American Lung Association and other public health organizations, FDA is currently engaged in a process to review many types of e-cigarettes to see if they should remain on the market. Under a court-ordered deadline of September 9th, 2021, FDA was supposed to have either affirmatively allowed the product to remain on the marketplace or to order it removed from the online and in-store retailers. Currently, FDA has resolved almost all of these pre-market tobacco product applications and has authorized a total of 23 tobacco-flavored e-cigarettes for sale in the United States. It has not authorized any flavored e-cigarette product for sale to date. Next slide, please. And then kind of a variant here regarding synthetic e-cigarettes. In 2021, a new potentially large loophole emerged in the form of synthetic nicotine, created in a laboratory instead of being derived from a tobacco plant. Puff Bar became the most used e-cigarette product among teens in 2021 and 2022 by exploiting this legal loophole. Puff Bar sells single-use e-cigarettes in kid-friendly flavors like mango, blueberry ice, and many others. In March 2022, a bipartisan law passed that expanded the FDA Center for Tobacco Products Authority so that it includes all synthetic nicotine products. Such products are required by the law to submit pre-market tobacco product applications to FDA to remain on the market. FDA is still working through those applications, but has not approved a synthetic nicotine product for sale to date. Next slide, please. Despite no flavored e-cigarettes being authorized for sale by FDA, millions remain available for sale across the US. FDA has several penalty options in its toolbox, including civil monetary penalties, and no tobacco sales orders for retailers or distributors, as well as working with the Department of Justice and Customs and Border Protection to seek injunctions against e-cigarette companies or stop products at the border. While all these penalties have been used or tried, it has not been at the scale needed to make a real difference to this point. Next slide, please. In case folks noticed the Iowa Hawkeyes flag in the background, the picture was taken by Iowa by one of my colleagues, just in full disclosure. But as of October 1, 2023, you'll see signs like this posted in 220,000 stores that sell cigarettes across the country. The signs must be posted by October 1 and will be posted for 21 months. So until October of 2025 or July of 2025 or so. The postings of these signs was one of the remedies of the U.S. versus Philip Morris civil RICO case decided way back in 2006, and in which the major tobacco companies were found to be convicted racketeers due to their decades-long conspiracy to deny the health effects of smoking and secondhand smoke. The posting of these signs in retail stores marks the last significant remedy in this case. 6 years ago, similar corrective statements were included in TV and newspaper ads. Next slide, please. I'll now switch over to a discussion about Iowa's grades in the Lung Association's State of Tobacco Control 2023 report, which was released last January, and some comparisons to states that border Iowa. Next slide. The Lung Association's State of Tobacco Control report grades states in 5 tobacco control policy areas proven to prevent and reduce tobacco use: funding for programs to prevent and reduce tobacco use, smoking restrictions in public places and workplaces, state tobacco taxes, access and coverage of tobacco use treatments, and restrictions on the sale of flavored tobacco products. As you can see on the slide, Iowa gets a good grade for its law that prohibits smoking in most public places and workplaces, but has room for improvement in the other areas to report grades on. You can find more information on the report and its methodology at lung.org/SOTC. Next slide, please. This is a chart of the grades Iowa received compared to the states that border Iowa. Generally speaking, several of Iowa's neighbors do better in the tobacco taxes and access to tobacco use treatment categories, but otherwise the grades are relatively similar, with the exception of Missouri, which gets the worst grades overall of the states on this slide, unfortunately. Next slide. And this is a map of all the states in the country and their cigarette tax rates. They range from a high of $5.35 per pack in New York State to 17 cents per pack in Missouri. So quite a wide variation between the highest and the lowest. Iowa is ranked 32nd in the country at $1.36 per pack. There's a wide variation in cigarette taxes among states in border Iowa as well, with the highest being Minnesota at $3.04 per pack and the lowest being Missouri again. Next slide. And this is a chart comparing several aspects of Iowa and its border states' taxes on other tobacco products, or OTP taxes for short. The Lung Association supports making taxes on tobacco products equivalent to the cigarette tax to reduce incentives for people to switch between cigarettes and other tobacco products rather than quitting for good. We also recommend that other tobacco products not be taxed by weight to allow the tax to keep up with inflation and industry price increases. Next slide, please. Increasing the price of tobacco products is one of the most effective ways to prevent and reduce tobacco use, especially among youth. Specifically in Iowa, increasing the tax by $1.50 per pack in Iowa would be expected to prevent 7,100 youth from becoming adults who smoke, help over 14,000 adults who smoke quit, save 5,600 lives, save $607 million in long-term healthcare costs, and generate over $450 million in new annual revenue for the state. Next slide. These are several of the strategies that tobacco and e-cigarette companies are using to help currently protect their profits at the expense of public health. One example of the redesigning product strategy is the push to add more nicotine to e-cigarettes. The majority of e-cigarette sales now go to high-strength nicotine e-cigarettes, whereas the opposite was true just several short years ago. This makes e-cigarettes significantly harder to quit for teens and adults too. You can usually tell how effective a particular policy will be at reducing tobacco use by whether tobacco companies file a lawsuit over it. Many of the policies I've mentioned during this presentation, especially at the national level, have had lawsuits filed against them. But the companies have been particularly aggressive about filing lawsuits against restrictions on the sale of flavored tobacco products lately. However, they have not won a lawsuit about state or local, when allowed by the state authority to pass these restrictions to date, I'm happy to report. Next slide. So I hope this presentation was informative. I know I threw a lot of information at people, so I look forward to answering any questions at the end. I'll now turn it over to Tabitha for her presentation. Thanks.
Hey, Thomas, too, one of your slides I wanted to ask you about because I think it's slightly more complex than some of the other subject matters. Can you tell us a little bit about the tobacco tax slide? I can bring it back up too. When we're talking about cigarette taxes, sometimes it's a little bit more simple, but tax is a fuller equation. So for Iowa to kind of address the cost of tobacco products, are you recommending a more holistic approach that we look at other products as well?
Absolutely, yeah. We certainly think that the taxes on tobacco products, other tobacco products, should be equivalent to the cigarette tax. That can be usually you can do that through a percentage of wholesale price tax that is basically, it's equal or equivalent to the cigarette tax, and that's certainly how we recommend doing it. There are other ways to do it too, but that way, like I said, you don't have unintended product switching to other products. We can keep the price consistent across products, basically. Is that what you're asking?
Exactly. That's exactly what I was asking. And, I think what you shared, as you shared, these are the strategies we find to be most effective in reducing youth initiation. So the rate at which youth start smoking, increasing cessation efforts. So that's why we keep coming back to them if those on the call have heard them before. And I just quickly wanted to share the Iowa Tobacco Prevention Alliance also makes, let me see if I can skip ahead to this. We have a set of legislative priorities that we set forth recommended for state legislative action based on the things national subject matter experts like our colleague Thomas at the Lung Association just proposed. These are things that they're tried and tested across the board. And first and foremost, modernizing the Iowa Smoke-Free Air Act. So the original Smoke-Free Air Act passed in Iowa in 2008. So just like Thomas was mentioning some national federal action in 2009, 2008, we saw a lot of states, including Illinois and Iowa, taking action to make workplaces smoke-free, which is excellent. And what gave us an A grade on the report card. However, if we want to, maintain that good grade, we have to modernize. And so in 2008, e-cigarettes really they were probably in product development, but they weren't so much on the market that we felt the need to address them in the Smoke-Free Air Act. So now we're seeing vapor products used in public places, which is problematic because secondhand aerosol, which is what's released from an e-cigarette vapor product, poses a risk to the bystander. So when we say smoke-free, that means all products in all places. And it also means all workplaces, which includes casinos. So also since 2008, the gaming industry has really expanded in the state of Iowa. There's more casino licenses, more employees, and more exposure to secondhand smoke. So those are two ways we could modernize the Smoke-Free Air Act. increasing our allocation for our tobacco prevention and cessation program to $12.8 million, which is the recommendation. And it kind of mirrors, so in the fiscal year 2022, Iowa received around $265 million in our tobacco tax collections, as well as master settlement agreement payments. As you'll remember, the master settlement agreement was when several state attorney generals litigated against the tobacco industry for healthcare costs related to smoking. So even though that took place in the 90s, we're still receiving those settlement payments totaling $265 million with tobacco tax revenue. So that's a significant amount. However, for the last fiscal year, 2023, Iowa only allocated $4 million or 1.5% of this tobacco revenue to programs to help people quit and to prevent Iowans from taking up smoking. So we're still well below the CDC recommended amount, which is 30 million. So taking us from 4 million to 12 million, we'd still be below what the Centers for Disease Control CDC recommends for best practice. But we still feel like this is a worthwhile investment where we know it's a tested ROI, good return on investment. And then, as we were just talking with Thomas, increasing the cost of all of our tobacco products, including e-cigarettes. So the equivalency equation there. So those are what we have outlined as our legislative priorities. The Iowa Tobacco Prevention Alliance, which is a coalition of groups, including American Cancer Society, Cancer Action Network, the American Heart Association, the American Lung Association, Americans for Non-Smokers' Rights, CAFE Iowa. So any other thoughts from my colleagues on the ITEPA platform or legislative priorities?
I'll just note the kind of tying the federal policies to the state policies. There are some of these some of the developments I talked about at the federal level could certainly induce smokers to quit in Iowa, and some of that could increase demand on services for quitting tobacco at the state level, which could be useful to consider as you think about how much revenue to dedicate to tobacco prevention cessation programs.
That's great. Thank you, Thomas. And most of the strategies Thomas and I have been talking about the national level, there's things happening federally, and then of course the state level, but there's also local opportunities to engage. And we do see opportunities for cities across the state of Iowa to close loopholes and smoke-free protections in places like membership clubs or veterans organizations, as well as addressing use of e-cigarettes in public places. So there are a small handful of communities, mostly concentrated in the Johnson County area, that have locally addressed e-cigarette use. But Thomas and our organization, we track local municipal ordinances that address smoke-free workplaces as well as use of e-cigarettes. So I think this is another opportunity where local Iowa decision makers could step up and fill the gap until we see further state or federal action. Thomas, is that a trend you continue to see in other states? How do you see people addressing youth vaping in successful evidence-based ways?
Yeah, we certainly see both cities and states moving to add e-cigarettes to their smoke-free laws. That's one way. Certainly incorporating e-cigarettes into other tobacco sales or retail policies can be beneficial as well too. So there's no reason that the other restrictions that we put on tobacco sales should not apply to e-cigarettes as well too, given the emergency evidence about their harm. So.
That's really helpful. I think for some time, it took us a little bit of time to react to the e-cigarette industry, which it used to be the e-cigarettes came on the market and you had the e-cigarette industry and the tobacco industry, but now we really see them as one. The big tobacco companies have invested in these product lines and companies. So it's really just, we see it as one encompassing industry, which is well-funded and certainly have powerful marketers and lobbyists. Do you see a correlation between youth e-cigarette use and tobacco industry marketing to target youth?
I mean, I think it's been proven that marketing, especially where a lot of the marketing happens now, is in the retail environment. And that's and so that's where most tobacco company marketing dollars are spent now. And there's actually contracts between retail stores, for example, where they place their marketing. And while adults may not notice it as much, it really is geared towards kids in a lot of ways. So putting it at their eye level, for example, and that kind of thing. So it's certainly more pernicious than you might expect anyway.
Yeah, absolutely. We see a lot of still product use in streaming, like on Netflix shows or you in the movies. And then social media as well, whether it's on TikTok or Instagram, influencers using these types of products, which kind of skirts outside the lines of the restrictions from major tobacco companies and their original, kind of settlements that require them not to market directly to youth. So that's of concern of ours as well. And the bottom line here is what continues to challenge our work here in Iowa and across the country is we still see significant tobacco industry interference and influence. Last year, when testifying on a bill to close loopholes for modernizing the Smoke-Free Air Act to address e-cigarettes, the tobacco industry lobbyists showed up to testify against the bill. So we really are seeing a full court press when it comes to the industry. So I wish, tobacco use was one of those things where we addressed it in 2008 and solved the problem, and now we can just go about our business, but that's just not the reality. And I know that there's decision makers on this call today that are thinking about all the complex problems that are facing our state today. But the reason that we really want to impress upon the importance of addressing secondhand smoke is that, tobacco use and secondhand smoke exposure, including use of e-cigarettes, remain a contributing leading cause of death and disease. And while that is incredibly concerning, we have all of this research and evidence base to show us exactly what could reduce that impact. So that's why, we're taking precious time out of your Tuesday on this beautiful, gorgeous fall day to talk about this pertinent issue, because as a decision maker, there are very few issues that you can pass a policy and see the immediate benefit in your lifetime, in your tenure still in office. You can see the benefits of the policies we've talked about today. And that's a really unique thing. Okay, I think maybe we have Tabitha on the phone. Thanks to Thomas for chiming in for some questions. Tabitha, I think I could maybe run slides for you. Can you do a test to see if we can hear you?
Hello, can everyone hear me?
Yes, we can hear
Hello,
you.
Can you hear me?
Yep.
Okay, perfect. I apologize. Technology is hard these days. Okay, so if we're on slide 2, I think we'll be good to go. All right, so let's talk more about the Iowa Tobacco Control Program. So our goal is really to reduce that overall prevalence of tobacco and nicotine use among Iowans, both adults and youth. Our program is funded federally by the CDC, Office on Smoking and Health, and through the Addictive Disorders Fund in Iowa. And Iowa's adopted the national tobacco control goals that you see here: preventing initiation, promoting cessation, eliminating exposure, and identifying and eliminating those tobacco-related disparities. We also know that evidence-based statewide tobacco control programs that are comprehensive, sustained, and accountable have been shown to reduce smoking rates as well as tobacco-related diseases and deaths. And we know that we've really done well in Iowa since the inception of the state tobacco program, but challenges still exist with new products entering the market almost every day, and delayed regulations at the federal level provide challenges in preventing tobacco, and even more specifically, vaping use among our youth. And Thomas kind of talked a little bit about that too. So next slide. So let's start by chatting a bit about the burden of tobacco in Iowa. I'd like to start with the economic burden. Oftentimes we forget that not only are there negative health outcomes, but there are significant financial burdens. And these really pose a toll on all Iowans, whether you use tobacco products or not. According to the Campaign for Tobacco-Free Kids State of Iowa fact sheet, in 2022, Iowa spent $1.49 billion in healthcare costs directly caused by smoking, another $391.9 million in Medicaid costs caused by smoking, and $3.1 billion in smoking-related productivity losses. And another, and 31.4% of cancer deaths in Iowa are related to smoking as well. Another thing to mention is that these amounts do not include health costs caused by exposure to secondhand smoke, smoking-caused fires, or use of non-cigarette tobacco products like vapes. Productivity losses are from smoking-caused premature death and illness that prevent people from working. Tobacco use also imposes costs such as damage to property, again, not included in these numbers. And really, it's no surprise we still have a large part of our population in Iowa using tobacco and nicotine products, not only because of the high amounts of addictive nicotine, but also considering the $106 million spent by the tobacco industry on predatory marketing tactics in Iowa, and an estimated $9.1 billion spent every year at the national level. Research studies that have been published have also found that kids are twice as sensitive to tobacco advertising as adults. Next slide. And there has been monumental progress in reducing cigarette consumption over the past 50 years. I like to walk through this a little bit just to kind of show. So starting with the Surgeon General's report on smoking released in the 60s, the broadcast ban in the 70s, the Master Settlement Agreement in the late 90s, of course, the Smoke-Free Air Act in 2008, FDA regulatory authority over tobacco products in 2009, and raising the age to purchase to 21 as of recent. And while there are many other smaller efforts that do not go unnoticed in between, all of these combined have led to a major decline in cigarette consumption. Next slide. So now that we've touched on the economic burden, as well as led you through a little timeline of events, let's get more serious with the burden on the people living in Iowa. And these people may be our families, our friends, our neighbors. I'm sure we all know someone who uses or has used tobacco or nicotine at some point. So where are we here in Iowa related to adult tobacco use rates compared to nationally? Well, we are consistently higher across all products. We have 14.6% using cigarettes and 11.5% nationally. 6.4% using e-cigarettes, 4.5% nationally, and then 4.1% using smokeless compared to 2.1% nationally. And I think the slide you're looking at might be a little bit different than the one I updated, but at any rate, I'll be able to share my slides afterwards so you can see the comparisons a little bit better. Next slide. Again, I don't think you all have this slide, but I'm gonna walk through it real quick. I like to break down this data by disparities, and this allows us to look a little bit closer at those populations with the highest smoking rates. So these are all Iowa smoking data. So males report statistically higher rates of smoking than females at 16.1%. Also, multiracial non-Hispanic Iowans reported the highest prevalence of cigarette smoking. Smoking rates were highest among the age group of 35 to 44-year-olds. And the prevalence of cigarette smoking decreased as level of education increased. So about a quarter of adult Iowans with less than a high school education reported current cigarette smoking. So that's 1 in 4, compared to 6.6% of college graduates. Also, adult Iowans with higher household incomes reported lower rates of current cigarette smoking. So about 29.3%, so like 1 in 3 of adults with incomes below $15,000 reported current smoking, compared to just 10.3% of adults with household incomes above $75,000. We also wanted to note that adults with disabilities reported a significantly higher prevalence of smoking cigarettes than did adults without disabilities, almost double. I think we're on to the youth tobacco use in Iowa. And we know that there's prominent use among youth, particularly e-cigarettes. And while there has been some fabulous work done in Iowa to prevent youth access to tobacco and nicotine products, such as adopting the age to purchase to 21 and educating our youth on the harmful effects of these products, our youth are still using tobacco at rates higher than the national level. 16.4% of Iowa high school students vape, compared to 14.1% nationally, and 6.7% smoke cigarettes compared to 2% nationally. That's more than triple. Another interesting data point is e-cigarette use is higher in high school females at 18.2% than males, than 14.1%. And then current e-cigarette use statistically increases with grade level. So 9th graders report using it 8.6%, and then by 12th grade, tripling, with over 1/4 of 12th graders currently using e-cigarettes. Next slide. And while youth rates of e-cigarette use have declined over the last couple of years, and we've made good progress in our efforts, and we hope to see that continue, we really must be careful to remember what is ahead, and more specifically, what is working against us. And that is the rapid change in the landscape of vaping products and nicotine products. This slide is from the FDA. If you all are familiar with Brian King, he kind of talked about this a few weeks ago on a presentation. And I just think it provides a great visual of just how this landscape is changing. The e-cigarette marketplace is literally changing weekly with the constant introduction of new products. And it's really hard for FDA to even keep up on all of these products. And you can see here just how those appealing products correspond to youth use rates and increase in sales. For example, in 2019, August of 2019, Juul was the top used product, and that's because, you know, it came in all sorts of flavors. Well, then our flavor ban took place, and Thomas kind of touched on this on a few of his slides earlier. And so you see Juul, you know, fall. Well, then that pink line, that's Puff Bar, and that's the disposable products that came in that weren't regulated the same. And so they were still able to have flavored products. And even then, even since this has been out, you know, a year, this is almost a year old, the devices, the product availability, and the brands are constantly changing among youth. Next slide. So where does the state tobacco program come into play to help educate on the risks of tobacco and nicotine products and to implement that comprehensive program? Well, we follow 5 overarching components that are evidence-based, using science and data, and deeply rooted in public health practice. And these have been proven to reduce tobacco and nicotine use. And if you look, you know, at cigarette use rates, like I said, 30, 40 years ago compared to where they are now, they have decreased. We know that. And these overarching areas are the state community interventions, of course, prevention campaigns, cessation interventions, that data, and then infrastructure and management. The next slide, and you'll have to click through these slides a little bit. So let's dive into the programs that have been around in Iowa for many years, making an impact on our communities. The tobacco program funds 27 community partnerships that cover all 99 counties across the state. These community partners are nonprofit organizations or public health agencies who implement those evidence-based strategies and activities that we talked about earlier that help reduce tobacco use overall and prevent use by youth into their local communities. And one of their major successes is educating businesses, schools, and daycares on the benefits of adopting comprehensive tobacco and nicotine policies. What that means is that it's not just tobacco products, but also nicotine, so that it includes products like vaping and smokeless products. Currently, there are over 2,400 policies that have been voluntarily adopted across Iowa. Next up is Quitline. Hopefully you all have heard of Quitline. Quitline Iowa offers cessation programming to Iowans wanting to quit tobacco and vaping. Quitline offers those dedicated programs targeted to populations in Iowa that are disproportionately affected by tobacco, including pregnant women, because in Iowa, pregnant women are using tobacco at almost double the rate of nationally, so we know that that's a disparate population. Those people living with behavioral health disorders, and of course, young adults. And in 2022, there were over 6,000 call attempts to Quitline Iowa. Next up is My Life, My Quit, which is the youth cessation program that was launched in late 2019. This was in an attempt to curb the youth vaping epidemic. Iowa was one of the first states to offer this program, which was simultaneous to the governor's campaign against vaping. The My Life, My Quit program offers quit coaching to teens 12 to 17 in Iowa who are addicted to nicotine. Next up is our ISTEP program. This is a program that's led by students and supported by adults. ISTEP is a statewide movement that's made up of young people grades 7 through 12 who really want to step up and take action against tobacco. ISTEP is the only statewide youth-led organization focused on ending tobacco in Iowa. Currently, there are 64 chapters registered throughout 32 counties across the state. And finally, our Smoke-Free Homes program, which provides smoke-free rental property listings on the Smoke-Free Homes Registry, which you can find online. The program works to educate landlords and property owners on the harmful effects of secondhand smoke, and it helps to eliminate second and third-hand smoke exposure for renters by providing model policies, free signage, cessation materials, and technical assistance. There are currently over 1,500 properties listed on the online registry, and this is continuing to grow year after year. Next slide. So where we have been is really important, but where we are going is just as equally important. We know that youth prevention and cessation is critical given the ever-changing landscape of tobacco products, most importantly, those youth-appealing flavors. We also know that with vaping comes more challenges for keeping our air clean and reducing exposure to harmful secondhand aerosol. Remember, vapes are not just emitting water, but rather cancer-causing chemicals and other harmful materials that are getting into our lungs. And providing those cessation programs that are effective and easily accessible. I think it's also important to remember that for decades, tobacco prevention work has been happening at the international, national, state, and local level because every level is important. There is not one cure-all. We know that a coordinated collaboration provides that comprehensive approach that has been successful for the last 50 years. I know that Iowa's tobacco program remains committed to implementing a comprehensive program, to overall protect the public health and make decisions based on science, data, and evidence. Next slide. And with that, I want to remind you all that you have someone in your local community that is doing the boots on the ground tobacco prevention and control work, and they would love to connect with you to share resources and information, provide education, whether that's to you or people you work with in your communities. And again, I'm always available if you have questions or would like more information on our programs, or if you're interested in learning more about new and emerging tobacco products. I have lots of presentations that talk about some of these products, how they work. So yeah, we're always available, and thank you for your time. I appreciate it. And again, apologize for all of the technical difficulties.
Thanks so much, Tabitha, and thank you for persisting so we could hear that really excellent information about attaching some of the data to exactly what we're facing here in Iowa. One question that came through, I wondered if you could touch on, was about I just briefly covered the master settlement agreement and how those dollars come through. And then we had a question come through about the Juul settlement funds and how those are being used. So I didn't know if you could maybe touch on master settlement agreement or Juul settlement.
Yeah, I'd be more than happy to talk about Juul settlement dollars. There's been a lot of questions about that. Right now, we're trying to be really mindful of how we're planning to use those funds. So I think, we're still working on a plan of what that looks like, how we're going to get communities involved, how we're going to get community partners involved, schools involved. I would like to note that I think there's 7 requirements of how we spend the money. So also, again, there is no time frame on when the money has to be spent. So that's kind of good news for us. It gives us time to, plan effectively so that we're not just, throwing money here or there on things that we don't know if, they're going to be effective or not. Great question.
Thank you. That's helpful. And this is again, as Thomas knows, the Juul settlement dollars, we're kind of tracking how that's happening in multiple states to add that layer of accountability to be sure that these funds are being used in a way that prevents youth usage and initiation and as originally intended, and also pursues the evidence-based strategies over some of the other suggestions that we might hear. And we totally get that. A lot of times it's school leadership or administrators who are coming to us with questions because they just don't know how to deal with the influx of products and use on their properties. And they're just really asking for support to figure out what to do. And referring them to the evidence base is really helpful. So
I'll just note too that a few of Iowa's neighbors or Midwest states have also allocated Juul settlement funding to tobacco prevention and control programs. I do know that Kansas, Nebraska, and Wisconsin have all done that. So just for folks to consider.
Yeah, that's really
Thomas, thanks for bringing that up. Wisconsin has actually put together a great plan where they've hosted town halls across the state on how they see, the funding to be used effectively. And I have met with their program manager to ask more about the details of that work that they've done because they've been successful in developing an effective strategy and plan.
I would also direct your attention. There was a few questions and discussion happening in the chat. So if you have a chance to take a look over there, please do so. Any other questions from the group or comments from my colleagues who didn't have a chance to chime in today? Okay, well, we very much look forward to staying in touch as we move through the remainder of 2023 and look to all the good we can accomplish together in 2024. Several of us will be in the Capitol during session. Hope to see you there. And I see we have a question, Senator Quirmbach. Quirmbach, do you want to come off mute and ask your question? You can go ahead. Yes, please go ahead, Senator Quirmbach, if you can go off mute and ask your question. Or if we aren't able to hear you, if you don't mind dropping it into the chat, that would be great. All right, well, we look forward to talking with you all very soon. Thanks for your continued dedication and work to make Iowa the healthiest place to live, work, and play. Thank you very much to our speakers, to Thomas and to Tabitha, and we'll talk to you all very soon. Thank you.